All right, good morning. This is the Anchorage COVID Emergency Operations Center operational update excuse me, for 28 July. Today is day 512 of the Municipal of Anchorage COVID-19 response. We understand that the situation with COVID is changing. However, our mission does not. The Municipal of Anchorage will continue to use the processes we have in place to respond. Situation overview. Go ahead.
Today is day 512 of our response. As currently reported, locally, we're at 544 cases since last week, 1 death and 14 hospitalizations, and statewide, up 1,395 cases, 3 deaths, and 32 hospitalizations. Next slide. For 213 resource requests, we've filled or otherwise satisfied 1,795. An additional 1 since last week, with 8 currently working. Next slide. In the Sullivan, we've got 311 clients, no change from last week. In the non-congregate shelters, 378 clients, up 14. That's 689 clients in all shelters, up 14, averaging 2,067 meals served per day. Next slide. In the last 7 days at the visit testing sites, there are 3,613 sample collections performed. And from last Wednesday to Monday, that's July 21st to 26th, there were 512 doses administered at all pods with 81,867 doses to date. As well, a reminder, our EOC situation report comes out once a week on Wednesdays. If you currently do not receive that report and would like to, please reach out to me. As well, we are working to create a new common operating picture tool, which when completed, will go out with the situation report. And over.
All right, thank you. Weather, go ahead.
Morning, this is Michael Ketz with the National Weather Service office out here at Sand Lake, and generally looking at cloudy sky today with a real hit and miss chance of some light rain. Does clear up a little bit, a mix of sun and clouds over the next 3 days, but increasing cloudiness and more rain coming in starting Saturday night into Sunday. A little breezy around the west side of town and down turning an arm. And other than that, a fairly quiet week. That concludes my briefing. Any questions?
Thank you, Weather. Testing, vaccines, go ahead.
Hey, good morning, everyone. This is Pat Ryder, Emerging Infectious Diseases Assistant Program Manager. Today with testing, Visit Healthcare had an increase of 15.91% over the previous 7-day sample collections. Our community cases are continuing to increase. As of July 25th, our estimated daily growth rate is 6%, and the cases are predicted to double in 11 and a half days. Our 14-day average reproductive rate is 1.338. Our 14-day average case rate is 25.6 for every 100,000 residents. Our current alert level is high. This indicates that there is widespread community transmission with many undetected cases. With vaccines, Visit Healthcare clinics had an increase in average daily vaccination of 2% from the previous week. And we do have some upcoming pop-up vaccine clinics. On Friday, we have the Imagination Station. On Saturday, we have the Lusac Library. On Tuesday, we have the Spenard Rec Center. And Wednesday, we have the celebration for the APD chief at the Anchorage Museum. Just a reminder, our mobile vaccine clinics can come to you wherever you are. For more information or to schedule, please dial 907-531-5100. Next slide, please. With regards to messaging from the Anchorage Health Department, as mentioned, our overall risk level is high. This is evidenced by the increase in cases for the municipality to a rate of 25.6 cases for every 100,000 residents, as well as the 88% increase in new resident cases from last week. That said, with approximately 58% of eligible residents ages 12 and older, and 60% of residents ages 16 and older having completed a COVID-19 vaccination series, Anchorage comprises 2 subpopulations with very different COVID-19 risk profiles. Unvaccinated individuals currently experience a risk for COVID-19 infection equivalent to an average daily new case count of approximately 32.9 for every 100,000 residents, whereas their vaccinated counterparts experience a risk equivalent to 6.6 for every 100,000 residents. Our consensus reproductive rate of 1.338 is higher than last week's consensus estimate of 1.25. A reminder that a reproductive rate above 1 indicates that the virus is continuing to spread. Finally, we continue to watch the following community factors which may increase COVID-19 risk within the municipality. These include the fact that the more transmissible Delta variant is spreading broadly in Anchorage. Case counts and hospitalizations are increasing rapidly in Anchorage and across the state. And case counts and hospitalizations are expected to continue increasing until we see a significant increase in vaccination coverage and/or the use of non-pharmacologic interventions, such as masks and social distancing. This concludes testing and vaccines. Barring any questions, end of report.
All right, thank you. Contracts logistics, go ahead.
Good morning. This is Wendy Reese with Contracts and Logistics Lead reporting. Mass Care, the EOC continues to support Mass Care contracts through November the 30th. The testing contract is currently extended through August the 8th and will continue extension to avoid any breaks in service. Vaccination contracts remain ongoing to improve the overall trending numbers with the COVID virus. Logistics and contracts continue to support staffing personnel contracts to meet COVID mission requirements. End of report.
Thank you. Finance, go ahead.
Good morning. This is Carrie Wiedeker reporting out for Finance. Currently, the EOC has encumbered $18,483,112. Our actual spent to date is $69,361,991 for a total of $87,845,104. It may be noticed that a couple of those numbers have actually gone down since the last meeting. That's because we are doing an in-depth scrub of our purchase orders to unencumber any money we can. Please continue submitting any invoices and supporting documentation to eocinvoices@anchorageak.gov. OEM does continue to seek cost recovery by way of FEMA public assistance. End of report.
Thank you, Finance. Safety, go ahead.
Good morning, this is Annalisa Roberts reporting out for Safety. So the best COVID vaccine is the one that's available. So don't wait for a specific brand. Below are the types of vaccines that are available, who they're available to, how many shots you'll need, and when you become fully vaccinated. While the CDC does not recommend one vaccine over another, it does advise that vaccines are not interchangeable. So if your first dose is the Moderna, your second dose should also be the Moderna. People who should not get vaccinated are those who have had a severe allergic reaction or an immediate allergic reaction following one of their COVID vaccines. And a severe reaction is one that needs to be treated with epinephrine or an EpiPen or medical care. An immediate allergic reaction means a reaction within 4 hours of exposure, including symptoms such as hives, swelling, or wheezing. So if any of you have had a reaction to your first vaccine, speak with your doctor before you get your second one. They might have a different alternative, or they might weigh the risk against the reward for it. So just keep those things in mind and stay healthy and report.
Thank you, Safety. Public Information, go ahead.
Hello, everyone. This is Public Information Officer Heather Arono, and I wanted to just start by going over our objective in public information, which, as you can see here, is to provide timely, accurate COVID-19 information and guidance as equitably as possible to the general public and targeted audiences so that individuals from all communities can make safe choices and find vaccination clinics and testing sites. This is our commitment to the community, and just wanted to reiterate that this is how we are going about just getting the best information out to the public as possible. Next slide, please. So to that, we are looking at some numbers in earlier slides that are not going in the right direction. And so we want to remind you that millions of Americans have made the choice to protect themselves, their family and friends, and their community from COVID-19. If you have not yet gotten a COVID-19 vaccine, now is a great time to do that. And if you have gotten the vaccine, talk about that choice with people that you care about and help them get information if they're looking for where they can get that. You can go to anchoragecovidvaccine.org for more information. You can also stay up to date through social media with our accounts. It's Anchorage OEM in one version or another on almost every platform. We are also doing some outreach with a vaccination clinic to people experiencing homelessness. This is going to be at the Aviator Hotel this Thursday from 3:30 to 4:30 p.m. And we are going to be offering free week-long bus passes for the first 20 people who come in and get vaccinated. So if you know anybody who is part of this population who might benefit from this information, please help pass that along. Continuing our daily outreach to the community and media members about vaccination clinics and testing, and continue to research what we can do, what information is most relevant. So if you see anything that you think would be of interest to the public, don't hesitate to reach out to us through our social media accounts and let us know. Barring any questions, end of report.
Thank you, Public Information. Liaison, go ahead.
Good morning. This is Luke Allwright, subbing in for Liaison Officer for the Anchorage EOC today. Thanks to all of our partners who were able to join us. Do we have any cooperators on the line that would like to report out? Okay, hearing none, let's get started with our hospitals. Is there anyone on the line for Alaska Native Medical Center?
Good morning, this is Kirsten at A&MC. Today we have 12 positives in our inpatient. 2 of those are in the CCU, both are on ventilators, and we have 0 PUIs.
Thank you. Providence Alaska Medical Center.
Hi, good morning. Today we have 26 COVID positive patients, 8 in ICU, 6 on a ventilator, 2 PUIs, and 3 COVID recovered patients. Thank you.
Thank you. And that's all for Liaison. Thank you.
Thank you. As a reminder, our next operational update brief will be 10 a.m. on 4th of August. Everybody have a great day. Stay safe. Thank you.